Hi students, so the question for today. The nurse is doing assessment on a client with pneumonia. What is the priority nursing assessment? So as you can see over here, we have a patient suffering from pneumonia, which is an infection of lung parenchyma. So we have signs and symptoms like temperature, lung sounds, oral intake, and WBC count. We have to find out what is the first nursing assessment that we are going to do on this patient. So let's take a look one by one. So temperature is an expected finding in pneumonia because this is a case of infection where the person will have fever. So this is one of the expected findings, right? Then the lung sounds. So the person will have adventitious lung sounds, which is also an expected finding. Now, the oral intake, the person might be dehydrated because of fever and his oral intake may be compromised. So this is also an expected finding because of temperature. And last is WBC count. Since this is a case of infection, so the WBC count obviously will be increased because he's having pneumonia. So since all of these are expected findings, so expected things are of low priority in nursing assessment. So what thing are we going to look for first? So we can wait for temperature because this is something very common in pneumonia, and so is the WBC count. This is also common in pneumonia. Since both of these signs are common in pneumonia, these are of low priority. Now we are left with lung sounds and oral intake, out of which obviously if we look at the category of A, B, C's, airway, so the respiratory system is of high priority. Therefore, our correct option is lung sounds. So we are going to first monitor lung sounds in this case. Hope it helps. Thank you so much.